Good morning, everyone. My name is Joan Batorf, and I'm a professor in the School of Nursing in the Faculty of Health and Social Development here at UBC Okanagan. Delighted to welcome you all to this event for Embrace Aging this morning. Before we begin, I want to respectfully acknowledge that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation and their people. I'd also like to acknowledge that some of you might be joining us today from many places, both near and far. And I'd like to acknowledge the traditional owners and caretakers of those lands as well. Welcome again to this event for our 9th annual Okanagan Embrace Aging Month. Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention here at UBC Okanagan, and with our partners, Interior Savings and Credit Union and Interior Health. The Embrace Aging Month, launched 9 years ago, was to celebrate and raise awareness about positive aging. And once again, we've organized a number of educational events and opportunities during the month of March. The sessions are designed for everyone, young and old, and focus on a variety of topics, as many of you may have already noticed, related to healthy aging and ways to improve quality of life among older adults and their caregivers. Our goal is to inspire each and every one of us to embrace positive aging. So some housekeeping things before we start. You'll notice a closed captioning box on your screen, and you can move that to a preferred place by clicking and dragging it, and you can turn it off using the live transcript button on the menu bar if you choose. There will be an opportunity at any time for you to type questions or comments in the chat box, and I encourage you to do that both during the presentation and following. Once the presentation is over, we'll read out those questions and comments that we have time to address, and so look forward to some discussion today. So today's event is brought to you by the Institute for Healthy Living and Chronic Disease Prevention. I'm especially delighted to introduce my colleague and our keynote speaker today, Dr. Jennifer Jakobi, who's a professor in the School of Health and Exercise Science and is lead of the Aging in Place Research Cluster on our campus and the NSERC Chair for Women in Science and Engineering here at UBC Okanagan. And she's going to talk about aging in place, reflections from Canadians. So welcome, Jen.
Sharing the screen here, you should be able to see it now. Is it visible? Joan and Jakobi, can everyone see the screen?
Yes, we can see it.
Perfect, thank you. So thank you, Joan, for the introduction, and thank you for the Institute for the support of the Aging in Place Research Cluster. I'm really honored to be here today to share the results that the cluster put together with our partner. Before I get underway with the presentation, what I would like to do is address one of the questions that I often get when I do presentations. And I'm just trying to put my slides here. And that question is, why do we do a land acknowledgement? So when I do community presentations, this comes up a lot. So I thought I'd address it here at the start. So it's a long-standing tradition of Indigenous people. And although this might be relatively new for non-Indigenous Canadians, officially recognizing the territory or the lands where we stand on them is really important, and it's always been important to Indigenous people. For us, non-Indigenous Canadians, it's actually an act of reconciliation that involves making a statement recognizing the traditional territory of the Indigenous people who called the land their home before we arrived, and in many cases still do call it their home. So this is a big way of, I think, summarizing what Mary Lyons of the Leech Lake Band of the Ojibwe said really well. Land is part of who we are. It's a mixture of our blood, our past, our current, and our future. We carry our ancestors in us, and they're around us, as you all do. And I think this resonates to what we're going to talk about today, aging in place. What we learned is our past, where we have lived, our families, who we have interacted with, all inform our passions, our decisions, and our choices about aging in place. So I think it's wonderful that we can bring these two elements together. If you're curious, and some people have been, UBC Okanagan is located on the silks and the Okanagan Nation, and it's the silk unceded and ancestral lands of these people. In this particular website, you can see how I've drilled into North America, and it's native-land, and this identifies all the indigenous lands or territories within North America. You can then, and I find this map so intriguing, you can drill in a little bit further and find exactly where the silks territory extends through and from. And if you're like me and geographically challenged, and these look like pretty pinks and don't tell you anything, what I did do was pull up a map of BC, and within the map of BC, drill down to where the Okanagan Nation is. It's a transboundary tribe that's separated at the 49th parallel. So there's 7 different nations within the Okanagan Nation. It goes as far south as northern Washington, which is the Colville Federated Tribes. It extends up through the interior valley, where here in Kelowna, our 2 closest would be West Bank First Nation and Okanagan Indian Band. And then it goes all the way up to the upper Nicola Band and the upper and lower Similkameen Indian Bands. So it's a really big geographical region. So I hope that did answer some people's questions that I often get in community presentations. So what are we here today? Well, the first thing I'm going to do is start by acknowledging my colleagues in the research cluster, the trainees that assisted with this research, and most notably the focus group, Melanie Fenton, the research coordinator for the Aging in Place, and Tia Frank, who was a consultant that we hired to help us get this report that will be released on our website following today's presentation, as well as the material ready for today's presentation to share with you all today during Embrace Aging. I'm going to start by giving you a brief introduction to the research cluster as part of the formal presentation, introduce our partner, the National Association of Federal Retirees. Then I'm going to get right into it. I'm going to provide a snapshot of what Aging in Place is from the literature. I'm going to share our findings from both the survey as well as the focus group, give you some conclusions, and then talk about some potential next steps, and of course, have questions. So first off, this is who we are. The objective of the Aging in Place Research Cluster is to support the needs and the choice of older women and men to age in place through high quality interdisciplinary research. We have individuals that span from engineering to psychology to medicine to rehabilitation approaches to personal care to kinesiology to health interventions. So we cover the gamut to support active living, functional independence, and social and emotional health. And then for this particular project, we had the pleasure of partnering with the National Association of Federal Retirees. Many of you today will be members of this organization. For those that are not, it is a national advocacy organization representing about 170,000 members across Canada. It's got more than 60,000 veterans in their family. And the association has been advocating for the improvements to the financial security, health and well-being of their members and all Canadians for over 50 years. Thank you for doing that. What they believe is that every Canadian today and in the future should benefit from better retirement, and that includes income security and a strong, sustainable healthcare system towards functional independence and social and emotional health. And it was wonderful to partner with you on this initiative. Thank you. So when we talk about older adults in Canada, what are we talking about? Well, the World Health Organization identified aging well as a #1 global priority and challenge in 2015. And why this might be is if you look at the particular line on this graph, in the year 2016, the number of children 0 to 14 exceeded the number of older adults 65 and plus. This was unprecedented. And the numbers continue to grow and separate between youth and older adults. So by 2030, the number of older adults is going to rise to over 9 million, close to 1/4 of Canadians' population. And luckily for us and thankful, the 2021 to 23rd decade has been declared the decade of healthy aging. And I hope we can support that initiative from the World Health Organization. To give you a little bit more context of who these older adults are, The 75 plus age group will double, about 2.1 times. By 2031, there's going to be over 10.4 million older adults. And over the next 20 years, 68% growth rate in this population. So there's a lot of older adults, and we want and need to support them. So this is where we went about trying to understand what aging in place is and the meaning behind it. So first off, living and aging in place is twofold. The first thing it means is what it means to live in a place. And we're going to talk about that. And second of all, how a place should accommodate one's aging process. So there's two elements, what it means to live in a place and how that place should accommodate a person's need. The primary aspect of aging well, aging in place, involves remaining in one's home of choice, safely and comfortably, regardless of your age. Now, back in 2016, the Canadian Census asked a few questions, and at that point, over 85% of older adults would prefer to age in place in their homes and in their communities. So we have some evidence of what older adults need from 5 years ago, but life has changed in the past 5 years. In part, we've had a 2-year, I don't want to say celebrated the anniversary, the 2-year anniversary of the global pandemic, but it is 2 years. So what does aging in place mean for older adults now and those in the future? So I do want to try to make this presentation a little bit interactive and also meet your needs. So when you see this little person in the bottom with questions floating about, there's going to be a question appear on your screen. And hopefully in the background, this question should come up right now. And it's a preference question that's going to ask you whether you prefer as an older adult to be called an older adult, a senior citizen, or an elder. Do we have that question appear? And if you go about just clicking on your choice, I'm going to do my best to adhere to that choice throughout this presentation. I generally use older adult, but if you prefer elder or senior citizen, I'm going to do my best to try to switch and use the term of your choice today. So while we're getting that poll in, I'm going to move the poll so you can see my slides again. Oh, whoops, that did not move the poll. And carry on with the presentation. And then when the answer is available, I'll see the answer. And like I said, I'll do my best to adhere. So what does aging in place mean? Oh, here we go. Perfect timing. Thank you in the background. 62% prefer older adults and 33% prefer senior citizen and 5% elder. Potentially because you might be an elder, and elder is often referred to as a specific member of an Indian band. So I will use older adults. Thank you. So when we look at aging in place, we have to consider home, a place to call home. Now, home is more than just a space to eat, sleep, and be sheltered. A home should offer a sense of safety, security, and belonging. A home should allow connection to your social support in your community. In the home, you need to be connected to infrastructure and amenities that satisfy your wants and needs as older adults. And a home needs to accommodate changing needs and values alongside personal and physiological transitions that all individuals, and I emphasize all individuals, experience as they age. So a home's got to meet a lot of functions. And considering home, this is what we went about doing with the Aging in Place survey and focus group. Our purpose was to understand home, aging in place, and choice from a national perspective. We wanted to gain current views of what aging in place means. Our approach was the national survey, followed by a focus group. For this particular study, we looked at older adults, 60 years and above, and access to a device with internet access. This was in order to fill out the survey and potentially participate in the focus groups if they were interested in doing so. We partnered with NAFARC, as I've already indicated, the National Association of Federal Retirees. So in this partnership, participants outside the group were not recruited, but what we didn't account for or accommodate is that individuals might have forwarded the surveys to friends on family members that were not members of the association. So there could have been a capturing of additional outside members. The focus group, when we got through the survey, we analyzed it, and we centered the focus group on 3 primary questions that arose from the 19-question survey. And I'll get to those questions in just a moment. This is who responded. We had a pretty similar response rate between males and females, about 48% to 52% female to male, respectively. The vast majority of our respondents were either married or common law, and they were Caucasian. One of the key questions we asked is, have you heard the term aging in place? And 70% of our respondents to the survey had heard the term. We also asked the question, has your experience this past year with the COVID-19 pandemic changed your perspective on aging in place? And 68% said no. That wasn't really surprising to us, but we think this is really informative to public policy in the future, as well as the current needs and wants of older adults, because the pandemic didn't change what they want or who they are. It only reinforced what they believe and need. And I'll get to that a little bit further as I carry on. What were the results of the survey? Well, the key ones that I'm going to focus on here before I go to the focus group are, what do you perceive aging in place to mean? 87% of the respondents believed it to be staying in your own home or avoiding long-term care. We clustered those together. 30% mentioned care or support as needed, and 8% noted independence or choice is what aging in place meant to them. Not a place, but a choice. Now, we also asked, in a perfect world, where would you choose to age in? The vast majority of our respondents indicated a single-family home. Second to that was a condo or an apartment. And then the response rates decreased to progressive assistance and assisted living. We also wanted to understand what were the factors to remain independent so that they could choose where they want to age in place. The most important factor was family supports, 29%. This comment to family supports is going to come up again in the future, because older adults were quite clear in their focus groups of how and where they want their family supports. Next to family supports was social supports, about 22%. After that, it was the built environment, things like housing, transportation, the sidewalks you walk on, the lights in the evening, basically things that are built by us as humans. Then there was physical supports, things like exercise programs. And lastly was cognitive supports. And coming in at 3% was a connection with the natural environment, things like parks and community gardens. I'm going to move on to the focus groups, because we took the survey and used the results from the survey to really hone in to ask these 3 specific questions in the focus groups. And these questions came about from the surveys. What does aging in place and aging with choice mean to you? What is your preferred housing and why? So really drilling down into that home environment. What kinds of supports for aging in place are important for you and why? Now, the focus groups had 5 men and 14 women participate, and they covered various regions of BC. About 68% of the focus groups covered various regions of BC, and then the rest were out throughout Canada. Now, these were the 3 questions that we asked within the focus groups based upon the survey. And what came about from the focus groups when we looked at the data and used a thematic analysis to peel apart and figure out what older adults were telling us is there were 5 particular areas that we needed to explore and report on deeper. And those 4 areas are covered in this little diagram here. Or, sorry, 5 areas, not 4 areas. The center point is always aging with choice. And aging in choice, it didn't matter whether we looked at the built environment, the social environment, communication information, or funding. So aging with choice resonated across the 3 different areas, and across the 4 different primary areas, funding was key, so it's stretched across all. As I move forward, I'm going to show this little diagram in the top corner of each particular slide. And the title of that slide is going to have a box around it. And the box is going to correspond to the colors of the area that I'm speaking to, because you won't be able to, at least I can't, see the specific little circles in the corner. So when it's yellow, we're going to talk about the built environment, things like accessible transportation, community supports, and housing. If we're looking at social, we're going to talk about family and friends and social inclusion, and then communication and information is green. Funding will be purple. So what did we find? And what did older adults tell us? Well, the key thing here is aging with choice. It's the center point. Older adults want to have choices about their living arrangements, and they want to be involved and make the decision themselves. And they recognize the need for anticipation and planning. So it's not just decision making, they're planning forward. And they want to ensure that decisions are made from a place of choice, not a place of necessity. And that requires some supports being available to them. And that's where we're going to go in the next few minutes with this presentation. The other thing is, in aging with choice, older adults want to live where they choose. And within that, they need to be aware of how physiological and social needs change and the types of support that they need to adapt and stay in their homes and communities. What this told us is they're really wise in their decision making. Their choices are dependent upon viable transportation, housing alterations, community supports, and services. And they recognize that if the supports aren't available to them, then they have to move for necessity rather than by choice. And that's not something that older adults want to do. The second element that we looked at was the built environment, yellow, the top circle. Excuse me. The tickle in my throat. Here we have aspects of the surroundings that are built. As I said, humans are building them. And it could be buildings, outdoor spaces, planned parks, lighting, transportation, sidewalks. There's a long list, but basically humans build them. The key element within the built environment is accessible transportation. Now, in the focus groups and through the surveys, most participants drove a vehicle or had access to one. Those that didn't, and even those that did, highlighted the dismal availability and accessibility of other transportation options. This is especially evident in smaller and more rural communities. The other piece that came up was the community supports and services available to older adults. Older adults that lived in communities and areas that were close to shops and clinics were better suited for older adults to age in place. So they're looking for accessibility and proximity to some of their needs as they make their choices. Housing. This is the other element of built environment that was key. Alternative housing and or adapting their current homes so that they can maintain their existence in the current community, either in their current home or within the community in another adjacent home. So there's adaptations that need to occur within the home or in moving to a home, and they're recognized. Things that were key as they start making these decisions and choices towards adaptation in housing is fear of falling, the inability to conquer stairs, and managing what we call ADLs, or activities of daily living. This will come out again as we start talking about social aspects. So activities of daily living are the things that you do every day in order to maintain your being. Things like self-grooming, feeding, clothing. Those are basic activities of daily living. Then you can progress upwards to more complex things like doing your own banking and your financing, planning ahead so that you can accommodate for upcoming needs and changes on a day-to-day basis. So the activities of daily living, things like medication changes, for example. So these are ADLs that older adults identified. What I have in the upcoming slides is little vignettes. So they're in the kind of bubble boxes. And these are phrases and words and statements that older adults in our focus groups made that capture the meaning across all of the focus groups. So this particular older adult, and they're not identified by name, and some of the words have been tweaked a little bit, or locations so that you can identify who these people are. That's really important in research is anonymity. So this person said, who are these people that are going to come in and help? Like, are they going to be these people around? You know, like help with meals, medication, or help with cleaning. Or even if you're ill, but not ill enough to be in hospital. Who's going to do that? Often you have a different person every day at a different time, and you don't have a choice unless you're going to hire them privately. So there was a real key messaging about support in home, which transitions to the social environment, in the built environment. How can we support older adults in their home? This then leads us to the social environment. So the social environment encompasses the immediate physical surroundings, social relationships, and cultural milieus to interact. And this offers emotional and practical support, and it's characterizing good social relations and social determinants of health. Now, social determinants of our health are non-medical factors that influence health outcomes. They're often conditions in which people are born into, work within, and grow within. So for example, food safety is sometimes something we discuss within the health determinant. The social environments, there were two that came up that were key. Family and friends. Family and friends are invaluable to aging in place experience. And in addition to this, access to community services, center, and social connections. And this is in order to provide a sense of community and social belonging. For many, the preference was not to burden family with responsibility of caring. They want services to supplement their needs, and this was seen as critical. And this resonates back to that earlier point where I said older adults reported one of the key things to age in place was family. Well, that key part of family is they don't want family as caregivers. They want family in their life, to be part of their life, not to be the decision makers and not to be the caregivers. So now we have a question, background to produce the question for me, please. So the question is, do you agree with this statement? When I need to be cared for, I would prefer to have a non-relative care for me in the home where I choose to age in place. And we'll pause there and wait for the answers. I feel like I need to have a drum roll or something, which I can't do. So as we're gathering the data on that, I'm going to flip to the next slide. Data should come up soon. So here's the answer. Do you agree with this statement? And 78% said yes, they would prefer to have someone outside their immediate family caring for them. And 22% said no. And I think this is an element that will come up in just a moment. Actually, I don't think, I know it's an element that's going to come up in my conclusion, which is the element of choice and how older adults are very heterogeneous. There's a lot of unique choices that are being made, and we need to meet them. So we're going to park that thought for a second, and let's carry on with where we were with the blue circle on the bottom left-hand corner, and that's the second part of the social environment. And this is social inclusion. This is ensuring not that you're just involved and active, but you have a sense of inclusion, being part of your community. And this is so important to stave off isolation and loneliness. And this came up during the pandemic a fair bit. The other thing that was really interesting and came up was the notion of intergenerational communities and activities. And this arose as a potential solution to combat isolation. So one older adult wrote, I think isolation is probably our biggest problem for just about all seniors. And the fact that we're treated like we're invisible. So maybe more community interaction of some sort with seniors and younger people, that maybe don't have seniors in their lives. And I think that's really beautiful. The element of intergenerational activity and sharing and learning. And I think it's not just going to benefit seniors then, it'll benefit youth as well. So this was a solution that was proposed. What about communication and information? Well, unsurprising, COVID-19 and the current pandemic came up a fair bit. And what was most interesting is the positive aspect as well as the negative that came forward. So what was brought to light was that we've already known everything that the COVID-19 pandemic highlighted. Placing older adults in long-term care is not sustainable or desired. So we've known that, you've known that, and it was really evident. One older adult indicated in the focus group, we've got governments that have been talking about this for a long time, that the boomer generation is getting older and older. And they've chosen to ignore how to deal with the situation of people such as ourselves. We want to stay at home. We don't want to be sent off to a nursing home. Governments have chosen to ignore that, and it's going to catch up with them. The second element that came out was communication and information was access to information. And as I've already indicated, there were positives and negatives. The big positive that came about was increased access to community services. Groceries, for example, came up as a key benefit of something that's come about since the pandemic. And it wasn't just, your delivery of cooked meals, it's actually the accessibility to ordering your groceries and picking your groceries up or having them delivered in a remote, non-contact way. So that was really a positive. With that positive, what was also identified is the heavy reliance on the internet to access services. Many older adults are feeling left out if they're not internet savvy. And that's the first point to keep in mind. It's not just access, it's internet savvy. It's knowing where and how to go and navigate the vast world of the internet. So that was one thing that was identified. The other aspect was reduced access to what previously used to be in-person services. And this became a key point when we talk about not only internet savvy, but those that don't have internet or don't know how to use internet. So older adults that aren't online are subjected to digital exclusion when services rely on the internet. And that came up as a key point. We have to figure out how to reach the older adults that can't reach out through the internet. I do want to go back to one element that came out in the survey that was brought about in focus groups, but I think the percentages here from the survey really resonate well to a comment I'm going to share. For communication and information, when older adults are gaining knowledge about health or science topics, they're relying, 1/3 of them are relying on their health practitioners. Next to that, they're relying on websites for government agencies. And I think that point about health practitioners is really, really key. One older adult said, I think COVID-19 has really been a wake-up call for a lot of people. People who got their medical advice from their doctor have found that they are now arm's length from their doctor, and they're waiting longer to see their doctor. So we need to see an expansion of access to information and services for people if they want to remain in place, wherever that place may be. So we have another question here. If you would mind putting the question up. And although older adults indicated physicians, we're curious about, would you go to a nurse or a nurse practitioner or another certified health practitioner for health information? And this is health information, not diagnosis or prescription. Yes or no? As the polls are coming in, I'm just going to flip to the next slide. I will pause before I start it, so there's time for people in the polls to collect in the background. I think it's about to flash up. 91% said yes. So it's quite interesting in that the solution is not just the family physician or the general practitioner. There's other places and resources that we can build and create for older adults to visit and go to. The last or the fifth area that's stretched across the three areas of the built environment, the social environment, and communication and information that resonated to the Aging with Choice central point is funding. Within this, I'm not talking about personal funding, and neither did the older adults, which is why I'm not speaking to it today. What came out was the resounding focus on wanting governments to concentrate on home support rather than long-term care. So we're talking about system support here. Older adults want to stay in place, and they want to have options to do so. And those options extend from community supports and services for information, access to services, as well as housing alternatives. And this requires a shift in political focus and budgets to meet the needs of our aging Canadian population. And very astutely put, one older adult said, "I'd like to see our health system more proactive than reactive to get better care and a better future for myself and my life." So in summary, what did we find? First off, the key thing is choice. Choice when it comes to decision-making, choice in where one lives, the type of home, the location of home, and the services and how they're gaining the services. This didn't surprise us a lot and it aligns with prior literature from Canada as well as elsewhere across the world. But what is the new knowledge that this survey and focus groups offered? Well, participants acknowledged the critical need for early anticipation and planning to maintain choice within each of these factors. They're not blindly choosing, they're planning. And that brings us to the second key point. That planning is proactive in their choices and their decision. And that proactive decision-making is seen as a form of preventative planning or preventative health decline, if you so choose to think of it that way, in order to avoid being moved to a place deemed less desirable. Now, how are we going to accommodate these choices? Well, the first off, and I've already identified it, older adults are not a homogeneous group. They're heterogeneous. So we have to look broadly as well as deeply into the needs that they have. Some want to live in rural and remote locations, and others opt to live in the cities, as we've already seen it. Although 91%, I believe the score was, might go to a healthcare provider beyond a physician, not everyone will. And I think that's also key when it came to family. There's definite differences of opinion on who wants their family to be caregivers and who wants to have outside caregiving so that they can remain in their home and their place of choice. And relative to the home, housing plays a key role, and there are various models identified, but there's three interrelated themes to accommodate the choice: physical accessibility within the home and the community, services and supports, and social participation and engagement. And this is where government and funding need to be placed. In summary, older adults have identified their choice and the supports they need to live out the choice. Thank you for your time. The report, the full report, will be released, if it's not already. Melanie might be hitting the button in the background, in the Aging in Place website. If you are interested in greater and more participation, and we value the opinions of all older adults, there's 3 particular studies underway. If you're anywhere in Canada, what we're really hoping to gather is an understanding of older adults' perceptions and use or not use of cannabis. So we have a cannabis survey underway, and that is for users and non-users of cannabis. We've had that question. Non-users are important to us as users. The other one is the personal and environmental and physical activity factors to influence health. This is an in-person study in Okanagan. And the last one is a foot sensation study on older adults with diabetes. So these are available to you, and you are welcome to have anyone participating in our studies. We do value your opinions and your contributions. And with that, I will say thank you for both listening as well as those who participated in the survey and focus group. You provided us, and we hope we've provided you with a wealth of information. Thank you.
Great. Thank you so much, Jen. It was great to hear those findings. We already have a slew of questions, so I think I'm going to go directly to the questions. So a question from Margaret, I think is a good place to start off. She asks, oh, I've lost it now. Hang on, my screen changed. Oh, here it is. How do the demographics of the survey respondents correspond to the demographics of the association's membership and of the Canadian population? For her, it seemed a little bit skewed, especially here in BC, perhaps. And maybe there was an over-representation of married white Caucasian people. I don't know, your thoughts, I guess, about the representation of the sample that participated.
First off, yes, 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 might be the easiest way to answer that question. It's something that we have discussed relative to the Canadian population and having a diverse sample. We got what we got, but we don't believe it to be diverse enough to represent the Canadian population. So Margaret, you're absolutely spot on. And that's something we're talking about and how to go about increasing that diversity from non-Caucasians, immigrants, to original settlers, the Indigenous people. So we're working on that. Relative to the representation for the National Association of Federal Retirees, they're pulling those numbers for us, and we will add those to the report once we get them. But as far as Canada, it's not diverse enough.
Yeah, great. Okay, thank you for that. I noticed a couple of people were struggling with the questions that you posed, and I must admit I was too. I wanted like a third and fourth option. And because Leslie says, for question 2, I may not have had a choice, so I can't choose either option. And I was feeling a little bit like that too. I wasn't sure. It won't be my preference. It would be a necessity. You know, and especially for those of us who might not have close relatives, for example, that we could invite to help us or ask to help us, whether they're close or we may not have any relatives at all, where there may not be a choice. And so, you know, any comments about that?
Yes, there are plenty of older adults around that don't have family nearby for various reasons. So yes, it might be a necessity. And that wasn't captured. I was hoping to capture that in the question. So thank you. So this brings us right back to that level of heterogeneity and choice. And sometimes the choices that we're making are based upon the situation we're living in. And that might be not having family nearby, even though they would want family to be that primary caregiver. It's just not accessible to them. And that's where then choice becomes, do I move? Do they move? Or do I go with outside care? And that is the element of heterogeneity, need, and choice. And what older adults we found were conveying is proactive decision-making. So thinking ahead to that point where they might need help and family's not here. So I don't want to leave my home. I like my community. So now I'm going to plan ahead to have outside help or potentially have family come in acute situation and have those conversations. Or one of the alternatives that we've seen here in the Okanagan, in our own neighborhoods, is older adults moving here to be closer to family. Mm-hmm. So it's about the choice, and that choice is a balance with necessity and proactive planning. Right. And older adults are really wise in that proactive planning.
Yeah. And I guess the choice also depends on the fact that there are a variety of things to choose from in your community for support. So I can also acknowledge that in some communities, there may not be a lot of options for choice. And I think that's the issue. I think even, you know, last night in our presentation with Andre Picard talking about, you know, long-term care, we think of these places that are these huge complexes and, you know, maybe there need to be different kinds of care homes, small ones, you know, in rural communities, they need to look different than in bigger communities. And even in bigger communities, they don't all have to be big complexes. And so we don't have at the moment a lot of choice around that, but could potentially have some choices if we began to think differently about care homes and senior residents and how they're structured and built.
What we're talking about is options. Older adults want options to make their choices, and those options are not vast right now. They're a built-in tradition of big facilities. So, you know, and even in the Okanagan, and I know you know this, Joan, and I'll share it with our audience. Happy Pad is a particular organization here, and I believe it's extending across the country, where in joking fashion, it's kind of like finding a roommate online, but the roommate is a university student. I believe in all cases it's a university student and an older adult that they cohabitate in the older adult's house. The university student is not meant to look after the older adult at all. The university student is not meant to be a care provider, nor is the older adult meant to be the care provider for the university student. They're roommates, but in being roommates, that element of intergenerational activity and sharing reduces aspects of isolation, and where university students are really finding this helpful and where they want to engage is international students, because a lot of the international students have that really strong connection with community and family. Many countries approach older adults and aging different than us, and those university students from other countries want to bring that here, and I think that's so rich. And that organization and app is growing. So it's something to watch for as an option, but there's so many options that are needed.
Yeah, it's a great example of shared housing where both people can win. There's obviously some income that's generated for the older adult and some very cost-effective housing for the students. So a win-win.
Absolutely, absolutely.
Yeah. Marg says, perhaps there's a difference between long-term care and nursing homes as currently exists. Perhaps the difference between long-term care and nursing homes currently exists and how we establish these could be. So again, we could start to have much more diversity in those kinds of settings where older adults may choose to live.
Yeah.
Guy goes on and asks this question: as a caregiver who had to place my spouse in long-term care, I agree it may not be sustainable, but can we afford full-time care at home? What's a possible solution or alternative that's affordable?
It's $1 million question. I think there's a large number of individuals in the government as well as different organizations trying to figure this out. Some of the things that came out in the conversation resonates back to my comment about options. So long-term care and versus in-home personal care both are very costly. They're costly from different levels, and who's paying for those levels. So for example, long-term care can be government assistance. In-home care often is not government assistance. So, and that came out through our survey responses. So a redistribution and allocation of how government invests in the caring process is part of the need. But the other element within that might be a progressive care system. One thing that came out within the intergenerational communities, as well as the progress or regress as you need more care, is to have maybe communities that are intergenerational to support each other, but also where older adults don't need assistance, then they might need a little bit of assistance, and then they might need more assistance, so that there's elements of like kind of a co-op or sharing that are both paid for as well as neighborly.
Yeah. Yeah, it is expensive to place people in long-term care for our healthcare system, for sure. So there's some trade-offs there. There's a question from Ellen. In my experience, 2 older persons in my life both received aging in place help in their homes after a fall, and they ended up in hospital. Their doctor didn't help in any way. Will this study be sent to all levels of government? So I guess comments about, I guess related to your presentation about making homes safe for people, but also, yeah, how we can help people avoid going into hospital. And clearly that's not, it may not be the role of the doctors to figure this out. They need all of our help, I think. So
I think it's an interdisciplinary healthcare team. And I think we need to expand what our vision and our acceptance of healthcare needs. So first off, I'll indicate that there is rehabilitation specialists, community specialists, there's nurses, there's so many professions beyond doctors to assist in the healthcare paradigm and continuum. And we need to educate people on where they are at with respect to, rehabilitation specialists, occupational therapists. I know when I started in academia, half the students I taught and didn't know what an occupational therapist was. And if you need assistance in your home when you come from the hospital, that is the occupational therapist that's going to tell you where to put the grab bar, whether you need a raised toilet seat, all of those home adaptations is the occupational therapist. But I want to take it one step back, and I'm going to put a plug in for those that we don't normally think about healthcare supporters and informants, and that's engineers. So Dr. Vicky Commissar and Jen Bogar are both members of our cluster. And Vicky right now is working with, and I wish I could remember the agency or the organization that are redoing the standards for stairs and handrails for reasons that were just raised. Falls, one of the key places where older adult falls are in their homes or on stairs. So be careful on your stairs, and those will change as we move forward with building design. But the other element, please, I hope I can log on to Facebook today and see everyone here selling their area rugs and their hall runners. The number one place for falls in the home are those lovely, beautiful rugs. Please protect your health and your hips before you protect your floors.
Good advice. And thanks for mentioning Dr. Vicky Commissar and Jen Boger in their research, because that's exactly what they're also researching, is ways to prevent falls in homes. And it's really fascinating research. If you have a chance to go back and listen to one of our previous webinars that was given by Dr. Commissar, she describes some of the research that she's done and is doing to prevent falls. And it's about adding things here and there in the home that will be ideally positioned in a way that will help people from falling. So it's really great research and very timely.
And she indicates it's Codes Canada. So that's who she's working with. This report will be shared with them and others that we hope to make some headway on so that organizations and government can support you. So yes, the report will be shared as widely as possible. And if you have specific suggestions, we'd love to hear them, and we'll make certain the report gets in those hands as well.
Great. Yes, Mark makes a comment too. Often our choices are not near either or binaries, but often more a mixture of necessity and choice. So I think that's why we were all a little frustrated with two options in those questions.
And yes, I agree, but it's good to hear the element of necessity coming out.
Yes,
I think that's important.
Absolutely. Leslie comments, your results are a clarion cry for more support for community health centers tied to senior centers. Congratulations in conceptualizing the results in a way to point out our communities in a much needed direction. So very nice comment. Thanks, Leslie. Another comment from Nao, I'm sure that's not the whole name, but that's all I see. We need to lobby the government for community care to support and allow aging in place. Chris asks, what are the possibility of getting doctors and nurse practitioners to do home visits outside of palliative care?
I don't know what the possibilities are. I think the idea is splendid. It definitely takes us back to our earlier days in Canada with respect to doctors visiting as opposed to doctors, and as opposed to you visiting doctors. So I think there's an evolution, and that's something that we could absolutely raise. Whether or not it'll happen is a little bit bigger than me.
Yeah, and obviously the move with COVID to virtual and phone medical health related consults is a step in that direction, but sometimes you actually need people in the home, and that might be a bit more of a challenge in terms of expanding our home care services. There is also a comment there's mention of various informative webinars. Where can one access these? Thanks for the formative presentation. So you can access any of our previous webinars by going on to the Institute for Healthy Living website. And I see Jakobi has put our YouTube channel address in the chat there. And if you click on that or go to our Institute website and go to our past events, it will also take you to the YouTube channel, or you can go directly here. And most of our previous webinars are up there and you can view them at any time. Mark asks, to what extent has mental health and mental well-being been included in your research and recommendations?
Excellent question. That came up largely in our findings with respect to social isolation and loneliness. And those are two big elements when it comes to mental health and well-being. Other elements that came up were diagnosed Alzheimer's or dementia disorders and caring for individuals that have cognitive decline. How to support cognitive decline so it doesn't happen was surprisingly to us not ranked very high. Elements of physical and social supports were ranked much higher than supports needed for cognitive decline. And like I said, that did surprise us a little bit.
Yeah, great. Well, I see we've nearly run out of time, and Jakobi has added our links into the chat. So I encourage people to have a look at previous webinars, but also this one as well will be posted on our website. And so you can pass it on to others. So as we close, I want to extend my sincere thanks to Jen Jakobi for sharing the results of this survey today. Aging in place is really high on everyone's agenda at the moment. So this is really such an important topic to be talking about and getting us all thinking about options and how we can create and contribute to those options in our community. So thank you again for sharing the results. And I want to also thank everyone for joining us today, and hope that we see you at some of our other Embrace Aging events through to the end of March. If you haven't had a chance to look at those, you can go to our Embrace Aging website. If you just Google Okanagan Embrace Aging, it will certainly come up. And you can have a look at the events that are coming up over the next couple of weeks. So thank you, everyone, and goodbye for now.
Thank you, Joan. Thank you, Jakobi.